Imagine a massive fight breaks out in a high school cafeteria.
Oh boy.
Yeah, we are talking dozens of kids involved, a huge crowd watching, just, total chaos.
Right.
Now imagine that entire fight is completely silent,
Hmm.
and it's happening at midnight, and the whole thing fits neatly inside a student's pocket.
Yeah,
Tomorrow
that's
morning when the bell rings, the school still has to clean up the blood, even though the punch was never actually thrown anywhere near the campus.
yeah. I mean, that is the daily reality of modern education, right there.
Right.
The physical campus is calm, the hallways are quiet, but there's a totally invisible, high stakes digital war happening right under the surface.
And it's wild. I mean, if you have a kid or even if you are just, fascinated by how Gen Z is surviving the digital age right now, you have to understand how the architecture of childhood has just fundamentally broken its physical boundaries.
Completely broken them.
Yeah. And so that is our mission for today. We are unpacking the shifting, almost non-existent boundaries of student mental health and digital harm.
It's such an important topic.
It really is. And we have two key sources driving our conversation today. The first is a tactical briefing that's currently circulating among school assistant principals on how to handle digital conflict.
Right.
And the second is the programmatic details of a systemic solution based in Georgia, which is called MentalSpace School.
Which is really, I mean, it is the perfect pairing for this deep dive because the briefing gives us the anatomy of the crisis, right? It outlines the problem. And then MentalSpace School shows us the actual structural blueprint for how to, actually survive it.
Exactly. So let's start with the crisis itself, because there is this singular dilemma that is keeping educators awake at night right now. The number one question assistant principals are asking is, what do we do when it happened online, at night, and off campus?
Right. And what's fascinating here is how desperately our institutions still cling to geographic boundaries.
Oh.
We built the entire education system on this idea of physical jurisdiction.
The chain link fence?
Exactly.
Right.
The school is responsible from, say, 8 a.m. to 3 p.m. within that chain link fence. And anything outside that box was deemed, well, a community problem, right? Or a parenting problem.
Right, yeah.
But our briefing highlights this quote that completely shatters that illusion. It states, and I'm quoting here, "The location of the phone is not the location of the harm. A group chat at 11 p.m. becomes a cafeteria at 11 a.m. The building inherits it either way."
Okay, let's unpack this. Because that phrase, the building inherited, it forces a total perspective shift.
It really does.
Like, I used to think of this like a sinking boat, ignoring a leak just because the water came from the outside.
Right.
Like, well, the boat is still sinking, but it's actually much deeper than that. I think it's more like trying to run a really heavy, massive background app on your smartphone.
Oh, that's a good way to put it.
Right. Like a student might be sitting quietly in biology class, staring at a textbook, totally silent. But their brain's internal processor is running at 99% capacity, just dealing with the fallout of a vicious group chat from the night before.
Yeah, that cognitive load is immense. I mean, there is literally zero battery power left for learning algebra or biology.
Right.
The school hasn't just inherited a conflict, they have inherited a student whose central nervous system is entirely hijacked by a fight-or-flight response.
Wow. Which means the symptoms bleed into the physical world.
Exactly.
And the briefing gives administrators a highly specific list of red flags to look for. Because even if the harm happened invisibly at midnight, the fallout is entirely visible in the daylight.
Yes.
So the first sign they mention is a sharp, sudden shift in mood immediately following a student checking their phone.
And this is where that background app analogy perfectly aligns.
Yeah.
Because the physical environment hasn't changed at all, the teacher is still talking, the lights are still on, but their digital reality just delivered an emotional shock.
Wow.
They receive a notification under the desk, and their demeanor instantly plummets.
It's that real-time drop.
Yeah.
And it leads to the next physical sign the briefing points out, which is sudden avoidance.
Right.
Like a student who previously had no issues will suddenly refuse to walk down a specific hallway, or they skip a certain class, or they absolutely refuse to go into the lunchroom.
Well, we have to look at the psychology of the physical space here.
Okay.
A lunchroom is highly exposed, it is loud, it is social, and it is largely unstructured.
Yeah.
If a student was targeted in a digital space the night before,
Yeah.
a loud cafeteria is the absolute last place they want to be.
Oh, man.
Because every laugh they hear feels like it's directed at them. Every group of whispering kids is a potential threat.
They are mapping a digital minefield onto a physical building.
Exactly.
Which also explains the third red flag, which is dropping a beloved activity with absolutely zero explanation.
Yep.
Not a slow fade of interest, just quitting overnight. Bam.
Yeah.
Done.
Because the activity itself was never the problem. The student loved soccer or they loved the debate team.
Right.
The problem is the social ecosystem within that activity.
Ah, I see.
If the digital rumors are circulating among the soccer team, the student will amputate the physical activity to escape the digital fallout. They are severing real-world ties just for digital survival.
That is so sad. Just severing those ties. And then there is the actual digital footprint the administrators are told to watch for.
Right.
The briefing talks about students constantly deleting and rebuilding their social accounts. And, just thinking about the energy required to do that is exhausting.
It is a pure defensive maneuver.
Yeah.
Their digital fortress was breached, so they burn it down and try to build a new one under a totally different username. It's a sign of a profound lack of safety.
And the ultimate sign of that lack of safety is the final red flag they mentioned, which is somatic symptoms.
Yes.
Physical complaints like headaches or stomach aches that magically appear on a Tuesday morning but miraculously vanish on Saturday.
Well, the nervous system is a powerful thing.
Yeah, it really is.
When a student's brain perceives the physical school building as the site of inevitable social trauma, the body will literally try to incapacitate them to prevent them from walking through those doors.
Wow.
The stomach ache isn't a lie, it's a physiological barricade.
Okay, so the background app is draining the battery, the body is rejecting the building, and the digital war has arrived in first period.
Exactly.
So how are schools actually advised to step in?
Well, this is...
The briefing moves from diagnosing the problem into a tactical playbook for educators, right?
Yes. And the very first rule flips traditional school discipline completely on its head.
Ooh.
It mandates document before you confiscate. Otherwise, the evidence vanishes.
Wow, okay. This is such a crucial shift in procedure.
It is.
Because historically, if a kid was looking at something inappropriate, the teacher's instant reflex was just to snatch the item away. Give me that.
Right, but the mechanics of modern platforms punish that reflex.
How so?
If an administrator confiscates a phone during a digital bullying incident, the screen locks.
Oh, right.
Or the platform uses ephemeral messaging like Snapchat, where the evidence deletes itself in 10 seconds.
Of course.
Or the aggressor sees the phone was taken and remotely unsends the abusive messages.
So it's just gone.
If the school doesn't take a physical screenshot or photograph the screen exactly as it appears in that second, the proof just evaporates.
You cannot intervene in a situation you can no longer prove exists.
Exactly.
But once you have the evidence, the next step is what really struck me in the source. It's brilliantly simple, yet probably really hard to execute in the chaos of a school day.
Yeah.
The briefing says give the student one trusted adult by name, rather than just handing them a bureaucratic procedure.
We have to look at how humans process institutional trauma.
Okay.
Handing a dysregulated student a heavy school handbook or pointing them toward the, quote, administrative disciplinary office, it feels incredibly cold.
Right, yeah.
It feels punitive. They feel like a liability the school is just trying to process.
Right. But if the assistant principal says, listen, I want you to go sit with Mr. Davis in room 204, he knows you are coming.
That changes the entire dynamic.
Yeah.
It provides a human anchor. In a moment of extreme instability, you do not need a policy. You need a person.
Now, I hear all this, and my millennial brain just wants to push back for a second here.
Sure.
I am genuinely trying to wrap my head around this. Because when I was younger, if you had a spat online, like on AOL Instant Messenger,
Oh, yeah, the away messages.
right, you just blocked the person and went to sleep.
Right.
Why isn't it enough today to just bring the kids into a room, force them to apologize, delete the app, and move on? Why does a digital conflict require this intense level of structural intervention?
It's a great question, but that instinct to just block them and move on is exactly the trap that modern schools fall into. Our briefing tackles this head on. Settling a logistical conflict does not repair what the student now believes about themselves.
Oh, okay, that distinction is massive.
Yeah.
Settling the conflict versus repairing the self-worth.
Yes. An administrator can force two kids to shake hands.
Right.
They can issue a 3-day suspension to the bully. They can mandate the post be deleted.
Sure.
That closes the disciplinary file. But the victim has already internalized whatever cruelty was blasted out to 500 of their peers in that midnight group chat.
500 peers. Yeah.
The anxiety, the public humiliation, the sudden hypervigilance. That trauma doesn't magically evaporate just because the principal stamped a form.
The damage is already downloaded.
Exactly.
Which is why the briefing strictly dictates a dual approach.
Yes.
You have to run the restorative conversation to handle the logistics of the conflict, and you must run the clinical support to handle the internal psychological damage at the exact same time.
And there is a third, highly overlooked component to this crisis.
What's that?
The briefing asks a vital question. Who else was in that group chat?
The bystanders, yes. This was easily the most surprising nugget in the source material for me.
Really?
It emphasizes the need to check on the students who simply watched the event unfold.
Because witnessing digital cruelty generates immense secondary trauma.
I can imagine.
Imagine being a 14-year-old in a group chat, watching a peer get systematically destroyed by 50 other kids.
Ugh, horrifying.
You are terrified to speak up because the mob might turn on you next. So you sit there, silently complicit.
The guilt of doing nothing.
The guilt is crushing. Plus, it shatters your trust in your entire peer group. You realize, wow, this is what my friends are capable of doing to someone.
Right.
If a school only treats the primary victim and punishes the primary aggressor, they are leaving dozens of bystanders quietly drowning in the psychological fallout.
The ripple effect of a single digital event is staggering.
It truly is.
So, okay, an assistant principal has documented the screen, they've assigned a trusted adult, managed the dual approach of restorative and clinical support, and checked on the bystanders.
Yes.
But what happens when the student trauma goes beyond what a high school guidance counselor can handle?
Oh.
The briefing says that if these symptoms persist, it becomes a conversation for a licensed clinician.
And that is exactly the moment where the traditional education infrastructure completely collapses.
It falls apart entirely.
Yes.
Because historically, the handoff to a clinician has been, honestly, a joke.
It has.
The school prints out a piece of paper, a list of local therapists, hands it to the parents, and essentially says, good luck navigating the American healthcare system. Hope you find an appointment before the semester ends.
That printed list is a systemic failure.
It really is.
Think about the barrier to care. A parent has to take that paper, cold call 15 different offices during their lunch break, leave voicemails, hear that the clinic isn't accepting new patients.
Or they don't take their insurance.
Exactly. Or discover they don't take their specific insurance. All while their child is sitting in their bedroom in active distress.
Yeah.
When that 6-month wait list fails, the school is left holding the bag. And that systemic failure is exactly what birthed models like MentalSpace School in Georgia, our second source for today.
And here is where it gets really interesting.
Yes.
Here's where we pivot from diagnosing the problem to scaling the solution.
Right.
Because MentalSpace School isn't just advice. It is a structural intervention.
Right.
It is a K-12 mental health support initiative designed specifically to replace that useless piece of paper.
They engineered a system that completely bypasses the traditional roadblocks.
Yeah.
And the most critical feature they offer is same-day teletherapy.
Same day. That is incredible.
It changes everything.
A student S processor is crashing in second period, and by the end of the school day, they are virtually face-to-face with a licensed professional. They collapse a timeline that usually takes 3 months into 3 hours.
Furthermore, they utilize dedicated therapist teams for each school.
Right. Instead of a rotating door of random screen doctors.
That consistency is vital. When a therapist is dedicated to a specific school, they begin to understand the cultural ecosystem of that building.
Oh, that makes sense.
They know the demographics, they understand the local pressures, they might even start to recognize the recurring social dynamics.
Right. Like, oh, this is the soccer team drama again.
Exactly. They become an integrated part of the school community, just operating through a digital window.
And we are not just talking about light general counseling here.
No, not at all.
The programmatic details outline a massive scope of practice. They're handling severe high-stakes issues, active crisis intervention, suicide prevention, and violence prevention.
Which is the brutal reality of where unmitigated digital harm eventually leads.
Right.
MentalSpace School also provides family counseling, acknowledging that you cannot treat a student in a vacuum without addressing their home environment.
So true.
And crucially, They offer staff wellness
It
programs,
is brilliant.
isn't it?
Because the teachers and the assistant principals are the ones bailing the water out of this boat every single morning.
Yes.
The educators are facing massive burnout trying to manage this digital flood.
And the professionals treating these students also reflect the student body. The initiative specifically ensures their licensed therapists are culturally competent and diverse.
Which is huge.
Huge. It vastly improves trust and clinical outcomes for students from all backgrounds.
Okay, let's talk about the giant elephant in the room whenever we mix healthcare and public education.
The bureaucracy.
The bureaucracy. The alphabet soup of privacy laws.
Right?
You have schools, which are bound by educational privacy laws, trying to talk to doctors who are bound by medical privacy laws. And usually, mixing these two results in lawyers just saying, absolutely not.
It is the classic tension between FERPA and HIPAA.
Right.
FERPA protects the student's math grade and disciplinary record. HIPAA protects the student's clinical therapy notes. Historically, trying to get a teacher and a therapist on the same page meant navigating a labyrinth of release forms and liability fears.
But MentalSpace School figured out the legal architecture here.
They did.
The source explicitly confirms they are fully HIPAA and FERPA compliant. They found a way to bridge the communication gap legally and safely.
And that legal compliance ties directly into a very timely pressure cooker for schools.
Yes, looking at our calendar today, it's August 19th, 2026.
Right.
The programmatic details specifically highlight their support for HB 268 compliance, noting a deadline of July 2026.
Right.
So what exactly is HB 268 for the folks who don't follow Georgia state legislation?
It is a state mandate requiring schools to establish specific, robust frameworks for student mental health support.
Okay.
And the deadline for compliance just passed last month.
Wow, okay.
Schools were scrambling to meet these legislative requirements, and MentalSpace positioned itself as a turnkey solution to ensure districts didn't run afoul of state law.
So they solved the legal hurdles. But the final boss of healthcare is always the funding.
Always.
Therapy is wildly expensive. How does a school district or a family afford same-day, dedicated professional therapy?
Well, the mechanism they use for financial access is arguably their most impressive feature.
Yeah.
They completely remove the insurance hunt from the parent's plate. For students on Medicaid, the out-of-pocket cost is exactly $0.
$0. I mean, that fundamentally alters the trajectory for lower-income students who are traditionally entirely locked out of private mental health care.
Absolutely. And for the families not on Medicaid, MentalSpace has negotiated a massive umbrella of coverage.
Right, looking at the source, they accept major private giants like Blue Cross Blue Shield, Cigna, Aetna, and United Healthcare.
Yes.
Alongside state-sponsored and regional plans like Peach State, CareSource, and AmeriGroup.
By casting a net that wide over both private and state plans, they virtually guarantee that financial logistics will not be the reason a student in crisis is denied help.
Right, you take the money barrier out of the equation.
Exactly.
So if we pull all of these pieces together, the dedicated teams, the legal compliance, the financial accessibility.
If we connect this to the bigger picture.
Yeah, we have to look at the ultimate question.
Yeah.
What is the real-world impact? Like, does this model actually work?
Well, the source provides the data.
And the numbers are staggering. Schools that implemented MentalSpace School saw an 89% improvement in attendance.
And let's connect that dot back to the beginning of our conversation.
Okay.
Remember the physical signs of digital harm?
The avoiding.
The sudden avoidance of the building, the somatic stomach aches.
Yes. You cure the stomachache by treating the trauma.
Exactly.
Treating mental health is ultimately the most effective truancy intervention.
It is.
When you lower the cognitive load from 99% back down to normal, the kid can actually walk through the front doors again.
The data supports exactly that. Alongside the attendance jump, they reported a 92% reduction in student anxiety and an 85% family satisfaction rate. They proved that when you collapse the distance between a student in distress and the clinical support they need, the entire educational ecosystem stabilizes.
That is just incredible. And just to note for our listeners, the source lists their contact as mentalspaceschool.com or mentalspaceschool at aatherapy.com for schools looking to implement the blueprint.
Right.
So what does this all mean for us? We started today looking at a boundary line. That old chain link fence that supposedly kept the digital world separate from the physical classroom?
Yeah.
That fence is gone. It has been permanently vaporized. The digital and physical worlds have violently collided, and schools can no longer operate purely as academic institutions.
They just can't.
The reality is they are being forced to evolve into frontline mental health triage centers. And to survive that evolution, they cannot rely on the archaic method of handing a parent a printed list of phone numbers.
No.
They require a real-time, professional, integrated infrastructure, exactly like the teletherapy model MentalSpace School is championing.
It is a total paradigm shift. And it leaves us with a profound question about the future of our communities.
What's that?
If a physical school building inherently inherits the emotional fallout of a late-night group chat, how long will it be until we have to completely redefine the physical architecture of a school? Will the blueprint of a school in 20 years look less like a rigid grid of traditional classrooms and more like a holistic community healthcare hub where the mental wellness wing holds just as much physical space as the gymnasium?